Hello, welcome back to the channel. This is week 9 update of the Lenire device treatment for tinnitus. Well, I got a couple things to speak about this week. As far as the week has went, it's been pretty much like a lot of them. I've stayed in that 7 to 8 range. Had a few bad days, worse than that, but kind of average. It's just been a 7 to 8. Nothing real spectacular this week. But one thing that I did this week was end up yesterday having my 9-week evaluation with the audiologist. And I know when we started this, we was just going to do a 2-week, a 6-week, and then a 12-week evaluation with the audiologist. But when I talked to her back on that 6-week evaluation, she said she wanted to go ahead and get back with me on week 9 and see how I was progressing. And so we did. We got together, and so I got some information from her to give you guys today that's pretty interesting. One of them I'll talk about was we talked about she had 6 different patients that finished up the 12-week process with Lenire. She had like 6 of them. And out of the 6, it was basically about a 50% success rate. She had 3 patients that their tinnitus just went down, just greatly went down to the point they were just ecstatic. She said they were just so happy. One of those patients she'd been keeping me up with, it was kind of like me. He was a little older than me. I'm 47. This patient was around 70, but he had loud noise exposure as well, and he had tinnitus for around 20 years, about the same amount as me. So I've been kind of curious of his updates of how he's been doing, because like I said, he has similar tinnitus as I do. And he was one of the patients that finished the 12 weeks, and she said that him and his wife both were in her office the other day, and they were both crying in her office because they were both so happy of how the Lenire device changed his life. That was his words. It was life-changing. It brought his tinnitus down greatly. I don't think it completely went away, but it brought it down to a level that he could live with, and he'd been struggling for a lot of years, and they was just both very, very happy about how it helped him. And so that was, like I said, 3 patients that have done really well so far. The other 3, she said, are going to continue on. They're going to go on past 12 weeks and do like another 6 to 12 week program with it and keep going and see if it'll bring it on down. And not that they haven't seen some improvement, but they haven't got to a point of a level of be comfortable with their tinnitus. So I just look at that. That's a 50% success rate out of 6 patients. 3's doing really well and 3 aren't. So that's how I look at it. And if you remember, I think she gave me a list of some patients on the 6-week video that I made, and it was basically about the same there. It was around 50% success rate at that time where people was at with their program. And so that's kind of the best I could share, I think, with what I'm seeing, talking to her anyway. It really is. It's a 50-50 gamble of whether or not this device seems to help people. And but for myself, like I said, up here on week 9, like I said, I'm still not seeing nothing really great. One thing that we decided to change on my program was she was telling me from time to time, some patients, she recalibrates the tongue tip. Sometimes the patients, after they use it for so long, will start saying they're not feeling the vibrance of the tongue tip that they need to be. And she asked me about where I was, if I was feeling the stimulation of the tongue tip like on the low points. And what that means is when you're doing the program, as the tones go up on your headset, the tones are sitting there constantly fluctuating from a higher volume to a lower volume, higher volume, lower volume, and higher pitched tones and lower pitched tones. And as the volume goes up on the headset when you're listening to it, the intensity on the tongue tip goes up. And then when the volume of the tones go down, the intensity on the tongue tip goes down. But the thing is, and this is if you're using the device right now or you get one thing to remember is when the tones go down to the lowest point running up and down in the program, you need to still always be able to feel that intensity on the tongue tip. It just needs to be a lower intensity versus, like I said, when the volume goes high, it's going to be, it's going to be stronger on your tongue. And I've noticed pretty much from day one, when mine goes down to the lower tones, I hardly feel anything on my tongue tip. And so, and I told her that a few different times, but it didn't seem like it was too big of a deal. But yesterday she said, well, let's recalibrate the tongue tip. So she walked me through how to recalibrate it. And basically I turned the power up on the tongue device. And so when I started using the program last night, and I've used it this morning, it's definitely more intense now. You feel a lot more on the lows than I was, and even just doing that ended up changing my tinnitus some. It ended up changing the tone a little bit, and it kind of ramped it up after that first evening of use with it ramped up. And she said that. She said it could actually give you a spike turning this up a little bit. And I did. I got just a little bit of spike from it. So, but anyway, now I'm going to, finish out at least these next 3 weeks with having a little more intensity on the tongue tip. We'll see if that does anything or not, but it's worth trying, I believe. So we've cranked that up a little bit, and pretty much that's it. I don't have really anything else to add for this week. I kind of get the feeling, I've got 3 weeks left in this program here. I really doubt I'm going to be at the level I need to be at week 12, and I almost feel the audiologist is, seeing that too with the way I'm progressing. It's very slow. So, like I said in I don't know if it was last week's video or when it was now, but I was saying, I'm probably going to have to keep going past 12 weeks. I just imagine to get where I need to be. Like I said, that don't mean that would happen for you. If you buy the device, you might be one of those patients that within 12 weeks it takes you to a real good spot. But I don't think for me it's going to. I'd love to say it will, but getting so close to the 12 weeks now, like I said, I'd really have to start working really hard to get there. I am still seeing those little breaks here and there. Like I've said in the past videos, when I take the device off, I get these little breaks. Last week video I talked about getting a 3-hour break, and that was really something, but that hasn't happened again since last week. And so, like I said, I'm just getting these little hit and miss signals here and there of progress, but like I said, it's very slow for me, very slow. And but anyhow, like I said, that's pretty much it for this week. Tune back in for week 10, and we'll see how we're doing there. And I thank everybody for watching.